Sarah Ferguson, Senior Editor for GEMS, and we're here at EMS Today 2018 in Charlotte, North Carolina. And today I am with Dr. Stein Bronsky, who is the Medical Director for Colorado Springs. He's been recognized as one of the 2017 EMS10 Innovators in EMS. And today we're just going to talk to him briefly about the work that he did in Colorado Springs. So tell us just briefly what was the work that you did in communication?
Well, what we did was try to change the culture of communication, not only within EMS and its communication with the hospital, but for the sake of the entire patient and their journey through their illness or injury. And so we employed a technology called Pulcera that is a communication system that allows us to seamlessly communicate the information about the patient, not only from the field to the hospital, but within the hospital, so that we create a more smooth continuum of care for patients. And one important thing also is that it creates a universal clock, so that we're all on the same page, and everybody is timing their interventions and procedures and patient care from the same standpoint. And all of that you wouldn't think makes a difference, but if we really go down and look at all the failures in communication that somebody can have from the second they call 911 to the time they receive definitive care, those communication failures cost a patient a lot of time and sometimes a lot of care. And so this is a fundamental change in how we provide that communication so that we can provide better care to patients.
And what are some of the results that you've seen so far? What kind of an impact has it had in the community?
Well, our impact, I think, has been large. Sometimes it's easier to see, sometimes it's harder to see depending on your vantage and who you work for. I mean, if you're EMS or you're in the hospital. But we decided as a community that we were going to do this as a whole community all together. So we got the competing hospital systems together, all of the hospitals themselves within those systems, and all of the surrounding EMS agencies to agree to come into this and do this. And so there were some, fun cobblestone roads along the way, and we learned a lot of lessons, but ultimately what we do see is that we can communicate to the hospitals more efficiently. We can get them the information they need to register patients so that we can, before their arrival, so that we can get them into their interventions faster. And overall, it provides much better systems of care for the patient. And so we are seeing that system change, and it is moving along very steadily.
It's an amazing achievement, and understandable why you were awarded one of the EMS10 Innovators for 2017. So congratulations, and thank you again for meeting with me. Really appreciate it. Again, this is Sarah Ferguson for GEMS at EMS Today 2018.